Good afternoon, everyone. I'm Tonya Phillips, and it was so nice to see a lot of your faces. I was actually in the room with you all when you had your initial training and launch of this program, so it was nice to see that you all are still plugging along and seeing such nice smiling faces. So I am Tonya Phillips. I am in the Southeast region of the American Cancer Society. I serve as a senior manager for health for our state and primary care health systems. I'm housed here in the Atlanta office. My staff covers the state of Georgia and North Florida. And alongside of me is actually one of my colleagues, Tanisha Jones, who is our manager here for the Atlanta market. So thank you for allowing us to come today. I was asked just to spend a few moments talking about the Great American Smokeout. So we're going to spend a little bit of time of learning about what it is, community engagement. I will reference some of our resources and tools. And then we'll talk a little bit about how to make this day relevant for your community. And if we have time, if there are those of you on the call who have participated in a Great American Smokeout event, we'd love to hear from you. Next. Okay. All right. So the Great American Smokeout this year will occur on November 21st. Since 1976, the American Cancer Society has hosted the Great American Smokeout. It's a public awareness event to encourage people to quit smoking. Organizations across the country use the event to encourage smokers to take action to quit. And the American Cancer Society supports any smoker who is considering smoking, no matter what approach they use. But hopefully they're using a proven cessation method. Next. So let's talk a little bit about community engagement. This event, participants may use the day to make a plan to quit to smoke in advance and to quit that day, or to make plans to engage in starting to look at quitting to smoking after the event. It challenges people to stop using tobacco and gives them tools and resources to support their efforts to quit. In many towns and communities across the country, local volunteers get together and promote the concept of quitting smoking, of a healthy lifestyle without tobacco use. And in some areas, they move forward to support local law initiatives. Right now, the Atlanta market is doing a smoke-free campaign with our mayoral office, wanting to make sure that Atlanta is smoke-free. So sometimes we're able to support those efforts as well. So you all probably know this much more than I do. You all have been engaged now, you said, Becky, 6 months?
Yes.
With this project? That quitting is difficult. And experts say that the best approach is to start with a plan and seek support. So this initiative really brings all of those components together. It provides resources and tools and support for community partners who want to quit smoking. And again, smokers are often advised to use proven cessation methods such as nicotine replacement, counseling, medication, etc. And so we have, in the American Cancer Society, we have a lot of resources available to assist you with that. So some of the key messaging around the Great American Smokeout is that it happens every year, the third Thursday of November each year. And this year, that should say the 21st of 2019. It is an opportunity for everyone to commit to a healthy, smoke-free lifestyle, not just a day, but year-round. Last year, the theme for GASCO was Day One. And that theme was selected to reflect what we know about smoking cessation, that quitting smoking isn't easy, it takes time and a plan. And the Great American Smokeout, or GASCO, isn't necessarily the day for smokers to quit smoking, but rather the day for smokers to start their journey toward a smoke-free lifestyle. I don't know what the theme is this year, but your ACS staff person, as soon as that hits the bucket, can share that with you as well.
I'm not sure it's going to be changing that much this year.
You're not sure?
No.
Okay. So just some resources, and again, your ACS staff partner can work with you to access these, and I believe, Becky, you're sharing some of these resources as well. Mm-hmm. But there's tons on our website. So we have tools and resources, communication tools. If you go to the next slide. These smoke out event tools are in English and Spanish for those of you who have a population that would need the Spanish version as well. The next slide. And then all kinds of goodies. So we have templates for posters, flyers, print ads, table signs, quick cards, a one-pager of the benefits of quitting smoking, and we have a communication tool. And so the communication tool, I just wanted to point out a couple of the highlights, is for internal and on-site communication as well as external. And you can use your internal tools to re-engage your leadership, to get them excited about this process, to maybe have them head up the GASCO event. You all are working with their housing authority residents. Get them to get on board, serve as advocates, help to promote this event in your community. And a reminder to the staff that you're working with, if they haven't quit smoking, to try and get them engaged in exploring the opportunity to quit around this time of year. And then for your external partners, there are templates for announcements, for press releases, for website information, things that you use for your newsletters and social media. So in thinking about this event, American Cancer Society encourages you to implement the Great American Smokeout event in ways that are most meaningful for your organization. And when I thought about this, so let's make this a smoke-free public housing tobacco cessation celebrates the Great American Smokeout. You want to make it relevant for your community. So what might be some things that you can do in your individual markets? And just in thinking about it, I thought, celebrate your efforts. I was talking to Becky before we started, and I've heard about some of the wins that you all have had in your communities. Broaden your outreach. I know that you've been working with your community partners, with your housing authority tenants, but maybe reaching out to those people who support them, family and friends. Invite them out to be a support to your residents, and also share information to them about how they can quit smoking. Celebrate the accomplishments of your constituents. You know, if there's someone who has been a quitter now for 2 or 3 months, celebrate that. That's hard. If someone had to stop and start a couple of times, but they're back on it, celebrate those accomplishments. This is a yearly event, so those friends and families and support people that you bring out, invite them back next year to celebrate their accomplishments again. And also use it as an opportunity to re-engage your community. If they've had a difficult time quitting or they've started smoking again, this is another opportunity for a fresh start and to re-engage in their cessation efforts. So you want to make this a fun event. And what can you do around that? Think about, are there other activities that would be complementary to your particular neighborhood? Would healthy cooking demonstrations be a draw? Would exercise, physical activity be a draw? Would music? Do you have community influencers that you can bring out that people would want to come and hear, or who could help promote your event? And then just real quickly, I provided 2 examples of 2 systems. One is a hospital, and one is the University of Hawaii. But the first one was Onslow, and they had pledges for their staff to quit smoking in their community, and they offered free turkey sandwiches to the first 100 attendees to come and be a part of their Great American Smokeout Day. They also had educational materials provided by ACS in their hospital.
Everybody loves food.
Everybody loves food. And I used to work a lot with senior citizens, and it didn't matter what you were giving away, as long as you were giving away something. They got excited. The next example is the University of Hawaii, and they had games and prizes, free giveaways, and again, distribution of health, education, and smoking cessation resources available. So I wanted to take a moment and just get some feedback from you all. Is there anybody on the call today who has participated in a GASCO event in the past? Please come off mute and share.
This is Maggie from St. Louis.
Hi.
When I worked in the Lakeshore Division years ago in Illinois, Southern Illinois University at Edwardsville, we had a large gastro event there. And kind of the same along the lines of the quitting cold turkey, we had frozen turkey bowling. So we used a frozen turkey as the bowling ball to hit the pins down. So they enjoyed that a lot. And we also put, like, we found some statistics of how many people die of smoking per day, per month. I forget what it was now. And we had that number of shoes in the middle,
wow.
Where all the kids kind of hung out between classes, just to kind of get a visual of what that was. So it was a neat event, though. We also provided information on Quit Line and how to quit, so we had the educational side of it as well. But the frozen turkey bowling went over very well with
That sounds neat. Also, the shoes is really an impactful visual for people to see. Thank you for sharing. Is there anyone else who would like to share? Has this sparked any ideas for any of you about what you might do for your GASCO event in November?
Yeah, and something else we've been talking a lot about, is engaging the healthcare providers and the community even outside of the health center, so local pharmacists or students, pharmacy students, and others, so they can be people to staff tables or answer questions. We have lots of resources, so I'll of course be in touch with you to see what resources you need, and I'll send you a box, much like I did at the beginning of the project. And I also wanted to point out, I got some other things made. I have these bags. Let me see if I can. There you go. So I can see who needs bags, who wants bags. I have these stress balls. Trying to. So I can offer some stress balls also. And of course we have, the pens that you've seen. And I have new stickers since I ran out of other stickers. And these are bigger, which I don't know, could be helpful. But I have these, and they're on rolls instead of individual now. So these would be cool things to give out to people who have committed. So I'll be in touch, to see who needs what, to help with some resources. And of course, we also have, patient-facing resources with actual information that they need. Absolutely. Not just stickers.
Becky, it's Frank. Hey, I know in many cities, most pharmacy students, school students need to do community service work. So I know in many cities they have volunteered to staff some of the tables or just be at any of these events. So if you're in a city where there's a pharmacy school, contact them and see if you can get some of the students to come and help.
Well, that's great. That's great. Thank you. And to complement all the cold turkey, to know what approved medications are available as well.
Thank you, Becky.
All right, thank you so much, Tonya. And of course, if anybody has questions or things they want to share, just let me know and I will, get it out to the group. Does anybody have any questions right now? Anything you wanted to ask while we have people who have had successful GASO events?
Becky, this is Bob. No questions, but just FYI, just one good or a technique, I guess, for bringing people in that's worked for us in some events in Boston and New York was haircuts.
Oh, that's a great idea. Haircuts.
Yeah. And again, make it relevant for your community. I mean, I remember some of you were in close proximity to schools. So do you want to do something where you bring students in to talk about not starting to smoke? Or as we have learned that even, younger students are beginning to engage in both tobacco use products. So make it relevant for your area.
And Beth had a great comment in the chat. An event she did in a community college campus had respiratory therapy students and teachers come, and they did lung capacity testing. So they blew into the tube to see how strong lungs were, which was an eye-opener for the smokers that perhaps they didn't have the lung capacity they thought they had.